Hello, I am Dr. Nancy Harthun, and this is a Society for Vascular Surgery briefing about poor wound healing. A wound is defined as a breakdown in the continuity of the skin. The time it takes to heal is determined by the depth and the width of the wound, the type of injury, whether penetrating or shear, and the amount of contamination incurred. Poor wound healing means that it takes longer than normal for full regrowth of skin. This longer time means that there is an increased risk of infection because bacteria and fungus have more time to colonize and reproduce. This leads to failure in regrowth of tissue elements needed to reclose the wound. The wound can actually worsen by enlarging and involving other adjacent tissues and structures. Good blood flow to the wound, normal function of immune cells in the blood, and protection of the wound from continued injury and contamination are necessary for normal wound healing. In situations where these needs are not met, poor wound healing may result. Many wounds that heal slowly are located on the feet or forelegs. These areas can suffer from poor blood flow. The arteries supplying the legs are prone to hardening and blockages that result from diabetes, smoking cigarettes, high blood pressure, family history of blockages, advanced age, and high cholesterol, or a combination of these risk factors. Poor blood flow limits the nutrients and cells available in an area of injury and necessary to heal wounds. The feet and forelegs are areas prone to chronic injury from the stress of walking. Pressure points result from constant abrasion with shoes. This can slow healing by injuring fragile new tissue. Shoes also provide a place for bacteria and fungus to colonize, and this may cause continued contamination in an otherwise clean wound. Diabetics have additional problems that lead to poor wound healing. Diabetes, through mechanisms that are not understood, causes nerve injury that limits a person's ability to feel. This is termed diabetic neuropathy, and in its advanced form leads to foot and foreleg wounds because the person cannot sense when his or her shoes or socks are causing an injury. The increased blood sugar content in diabetics supplies bacteria with a particularly supportive environment and leads to increased infections in the wounds once they start. Many studies have shown an important reduction in infections in patients after surgery if the level of blood sugar is controlled very stringently. Cigarette smoking contributes to poor wound healing by causing spasm of small vessels supplying the skin and soft tissue. This again limits the ability of important immune cells from reaching the injured area and also limits the nutrients available as well. Smoking also limits cleanliness of the wound and probably contributes to increased contamination. So how do we treat poor wound healing? First, if blood flow to an area of injury is limited, this must be corrected. Typically, this requires an invasive procedure to open up or bypass an area of stenosis or total blockage. Second, we want to provide a good environment for new tissue growth. This is done by cleaning the wound at least 2 times a day and keeping a dressing in place that provides moisture, usually with a saline solution. Third, we can administer antibiotics through a vein, with a pill, or with a topical ointment. This type and route of antibiotics is chosen based on proven or suspected infection or contamination. Careful control of blood sugar level is important to limit the growth of bacteria. Fourth, care must be taken to prevent continued injury. Various modifications in dressings and shoes can avoid continued abrasion of the wound as it heals. This care must be maintained even after the wound is healed so that new fragile tissue will not be re-injured, causing a recurrence in the wound. This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.